My name's Kristen Warren. I've been with Ascension Health for 10 years. Before coming to work in a hospital, I was an appropriation and healthcare policy analyst for a caucus in the state legislature. And in 2003, I had a really bad car accident that severed my right foot. Everything's okay, I got it back, but I spent a very long time in the hospital and 3 months on bed rest, and then went through the wheelchair and the walker and the crutches and the cane, learning to walk again. It was a very long time before I was able to return to work. And when I was, the husband of a former boss and one of my political mentors called me up and said, "Do you really want to go back to the state and study how you can get health care for the poor and vulnerable, or do you want to come to work at Seton and watch how we do it every single day?" We aren't bedside nurses, we're not physicians, but every single person on that team has a dedication that goes above and beyond. We know that our work impacts patient lives. We know that it impacts families, it impacts our community. We don't work for a garden center, we don't work for a retailer or a bank. We are always on call. And every decision we make, we have to think through and collaborate with our clinical partners. And that collaboration is transforming healthcare. I saw a sign once in an office in a different health ministry, and I stole the concept. But it says, if you're not caring for a patient, you're caring for someone who is. That's something that I take to heart. I feel like I bring my patient experience to my job every single day. We need to think about how our decisions and our structure and our build can help make a clinician's job easier, can free them up to spend more time at the bedside with their patient. But I also like to look at it through a patient lens. Is this going to make technology more accessible to me? Is it going to make it easier for my caregivers to get the information they need to my doctors? Does it slow down or speed up how quickly I get care, and am I getting the right care? The similarities between clinicians and technicians far outweigh the differences. I'm the only person, I feel like, in my department that's neither clinical nor technical. I'm not a physician, I'm not a nurse, I'm not a software engineer, I'm not a developer. I get to sit between the two groups and translate how they talk to each other. When they talk about what they need at the bedside versus a developer saying, here's a tool I can give you and let me tell you how it can work. I figured out these guys have the exact same personality type. It's sometimes oil and water, but they love to talk in jargon. They love to be the smartest guy in the room. Sometimes it's hard to compromise. When you can translate the desire to improve patient care and get both sides talking, amazing things can happen. That's probably what I'm proudest about.